Our opening rant yesterday, my opening rant yesterday was about Mifepristone and the whole possible consequences of this judge in Texas deciding to rule. Basically, there's a variety of ways he could rule, but basically, making the drug unavailable to women who need it, both for miscarriage and for abortion. And this is a big deal. We still have not gotten the decision yet, but we're still waiting. On the line with us is the Senior Vice President of MomsRising, Monifa Bandele, and momsrising.org is the website, and MomsRising also the Twitter handle. Monifa, welcome to the program. Thanks for joining us today. Tell us about who are the people who are actually seeking abortions in America. I think they're being broadly mischaracterized as irresponsible young women, by and large, and single young women, and how these attacks on reproductive rights are hurting people across the board, but in particular people who don't have access to good medical services and don't have a lot of cash.
Yeah, this is a really good question. There's a huge mythology out there about who seeks and needs abortions. The fact of the matter is that 6 out of the 10 people who seek abortions are actually already mothers. They're making decisions about their health. They're making decisions about their family economic security. They're making decisions about their education, their housing. All a huge amount of different issues come into play, as moms know, and as we know at MomsRising, when you decide if and when you're going to have another child. And so this mischaracterization that's put out there is really helping to kind of like feed this narrative that somehow this is about a group of people who need to be more responsible, who are quote unquote irresponsible. But I also want to say that at MomsRising, we of course believe that everyone who needs and wants to seek an abortion should have access to it, whether they're that mother trying to decide if she's healthy enough or financially stable enough to have a second or third or fourth child, as well as someone who is young and single, and whatever their circumstances are. Because we do know that not having access to this very important healthcare, because abortion is healthcare, has huge impacts, especially on communities of color and poor people.
Expand on that. How so?
Well, here's another big thing people don't know. The United States is actually the most dangerous place to give birth amongst wealthy nations. So when you line up all the developed nations who tout that they have infrastructure and are living a quote unquote first world status, the United States ranks last in terms of being a safe place for a birthing person to bring a child into this world. We have the highest maternal mortality rate amongst all of those nations. And when you look at who is experiencing the most maternal mortality, which is death during birth, labor, and postpartum, or maternal morbidity, which is becoming close to dying or having some type of long-term health issue during birth, it is disproportionately Black women and Indigenous women. And I want to underscore that this is even after you control for things like wealth and income, education, and previous health conditions.
So this is purely a function of structural and institutional racism?
Absolutely. And it's compounded, right? Like it's sexism is why maternal health care is so poor in this country, compounded by the structural racism. So you have these huge racial disparities. And of course, class always plays an issue as well. That kind of sits on top of it. But what we are finding is that at the core, at the heart of this maternal mortality crisis that we're having in the United States, because guess what? The rates are going up since the pandemic began, is racism, structural racism. We receive stories from moms all over the country that talk about their experiences in labor and delivery. And so much of what is putting their lives at risk are things like being ignored, not being listened to, being treated callously and racist. And all of these things have these hugely negative and sadly deadly consequences.
Yeah, it truly is tragic. What is the, and in fact, I think it builds on the studies that, for example, painkillers in hospitals, that Black people are less likely to have good pain management than white people. And this goes back to this perception or mythology or cruel mythology from slavery eras that people with dark
That
skin
Black
don't
people
feel
experience
pain.
less pain.
Exactly.
Yes.
Yeah.
And it goes back to the slavery era, like you said, but even recently, if you look back 10 years, this was still being taught in some medical schools,
Oh my
right?
God.
They still had the studies buried in the books that medical students had access to, that somehow Black people experience less pain than white people. And in fact, we only recently are moving past a racist predictor around kidney function. You know, there was this mythology that Black people had a different kind of kidney function from white people, and therefore Black people were waiting longer who needed kidney transplants than white people because of these mythologies about the physiological makeup, right, of Black bodies.
Right.
So
Right.
it goes back, but it's also recent, because as soon as you're teaching a medical student that Black people have different kidney functions for some reason because of race, all other kinds of things can sit on that, like experiencing less pain. And then, of course, wrapped up in that is the criminology, how Black people have been criminalized. And so when we even ask for pain medication, there's this idea that we're trying to get some more pain medication to sell it, or that there may be some other issue there. And we are up against so much. So you even see highly educated, wealthy Black women like Serena Williams. That was a breakthrough story that we shared, experiencing racism while giving birth, and it literally jeopardizing her life.
Yeah, it's just, in a way it's astonishing, and in a way it's predictable. I mean, this is the consequence of the circumstances that Black people have faced in this country for 400 years. The lawsuit in Texas, I haven't heard anything out of this court. Do you know the status of this lawsuit, or are we all just waiting, for the next shoe to drop? And if so, what are the possible ways in which that shoe can drop, and what would the impacts of those be?
We're all on the edge of our seats, right? I mean, it's the issue around abortion access has been one dumpster fire after the other, right? Ever since Roe fell because of the Dobbs decision, and states one by one, the trigger states put abortion bans in place right away. And so it's been whack-a-mole. This judge in Texas should be issuing a decision any day now, or maybe even any minute now. And it would essentially try to ban access to abortion medication that people have been using for decades.
Right.
It's been safe
Safely
by the FDA.
Yep.
Say that one more time.
I'm sorry, I was just agreeing with you. Keep going.
Yeah, and so it's going to impact not just people who live in the states that are trying to ban abortion. This will impact access to this medication that, again, has been on the market for decades, to everyone in every state around the country who wants to do a self-medicated abortion. So this is huge. But what we do know is that when the decision comes, it will be appealed right away. And so we will have another chance to fight it out. Even if it comes down today, there's going to be many, many different phases to this court fight. And ultimately, though, if the people who have brought this lawsuit prevail, we will lose access to a very important medication.
Right, and this will force women back into surgical abortions, which forces them back onto sidewalks where these religious freaks can yell and scream and spit at them and photograph them and follow them home and get their license plate numbers and publicize their homes and their addresses and their phone numbers and things, and essentially torment them. And in states like Texas, if a woman has left the state when she comes home, might have really terrible circumstances awaiting her, including a $10,000 fine.
And it's important to understand that wealthy women, women who have great means, will always be able to seek the services they need, right? Through private doctors, clinics, probably even access banned medications. This will disproportionately impact everyday folks, people of color, poor folks, people who can't who can't fly out of the country if they need to, right? To do what they have to do and come back, and not have it be something that's public, or, like you said, not be stalked at a clinic. And I also wanted to underscore that we've already talked about maternal health and what bad outcomes and experiences that Black women and Indigenous women have in healthcare facilities. So driving women back into these same types of circumstances, is also emotionally and mentally exhausting. It takes a toll on your health overall to constantly be put back into these systems and institutions that are racist.
Yeah, I view this as sadism. I think these people are sadists who want to push these women back into these circumstances. I think they delight in torturing these women, but I may be just totally nuts in that regard. Anyhow, Monifa, thank you so much for dropping by and speaking with us.
Thank you so much for having me. I do want to make one really quick point, which is that there's a direct connection between the maternal mortality rates in states that have a high maternal death rate and states that ban abortions. It's the same states.